All right, I'm going to get started here. Pull up my presentation. All right, so I decided to do my presentation on children with leukemia. So most commonly, leukemia is a cancer of the white blood cells, but some forms of leukemia begin in other types of blood cells. Leukemia can be characterized as acute or chronic. Acute indicates that the cancer is growing rapidly, while chronic indicates that the cancer is growing slowly. Almost all childhood leukemia is acute. So, leukemia forms in the bone marrow or the soft inner part of most bones. This is where new blood cells are created. And then once the leukemia forms, it invades the blood fairly quickly. So there are two types of leukemia that are considered acute. The first is acute lymphocytic leukemia, and the second is acute myelogenous leukemia. AML is also known as acute myeloid leukemia, acute myelocytic leukemia, or acute non-lymphocytic leukemia. Each form of acute leukemia is named after the type of blood cell that the cancer grows from. For example, acute lymphocytic leukemia grows from lymphoid cells, while acute myelogenous leukemia grows from myeloid cells. So here are some pictures of the different types of blood cells. So acute lymphocytic leukemia forms from lymphocytes, which are these right here. And acute myelogenous leukemia forms from red blood cells, platelets, and all the other forms of white blood cells, with the exception of the lymphocytes. All right. So the symptoms of leukemia are mostly caused due to problems in the bone marrow because this is where the cancer forms. The growth of leukemia cells can overpower the normal blood cells and cause a child not to have enough healthy red blood cells, white blood cells, and blood platelets. Red blood cells are responsible for carrying oxygen to all of the cells in the body. So here are the list of symptoms that occur when the red blood cell count is low. So white blood cells are responsible for helping the body fight off germs. Leukemia typically produces more white blood cells, but these don't protect the body against infection. And platelets in the blood typically help stop bleeding. Right. So, bone or joint pain is caused by the accumulation of leukemia cells near the surface of the bone or inside the joint. Swelling of the abdomen occurs when leukemia cells collect in the liver or spleen. This can make the organs appear bigger than they are, so like swelling of the belly. If the spleen and or liver reach a certain size, they can press against other organs like the stomach. This can cause a child to feel full after eating a small portion of food. So, with forms of treatment, the primary form of treatment for leukemia is chemotherapy. So, chemotherapy drugs enter the bloodstream and reach all areas of the body. Generally speaking, treatment for acute myeloid leukemia or AML uses higher doses of chemo over a short period of time, and usually less than 1 year treatment for acute lymphocytic leukemia. This uses lower doses of chemo over a longer period of time, so usually 2 to 3 years. Radiation therapy is the use of high energy X rays or other types of radiation to eliminate cancer cells or to keep them from growing. Uh, Another thing that can be done is a stem cell or bone marrow transplant, and this can sometimes be used to help improve the chances of curing leukemia. So it usually involves a donor who provides blood forming stem cells, usually a brother or a sister with the same tissue type as the patient. A stem cell transplant is used for children with which is acute lymphocytic leukemia, who belong to high risk groups. So this means that the leukemia is more likely to come back after the initial or the induction stage of chemotherapy. This is also an option if the leukemia doesn't respond well to initial treatment. Um, AML relapses more often than ALL. So stem cell transplant might be prescribed right after the AML has gone into remission. And there's also immunotherapy, and this is a newer form of treatment that's still being researched. So this involves the removal of T cells from the child's blood. These cells are then genetically altered in the lab to have specific receptors called chimeric antigen receptors or CARs on their surface. The T cells are then multiplied in the lab and returned into the child's blood where they can seek out the leukemia cells and attack them. All right. So, treatment outcomes. So, there are 3 phases of chemotherapy. The first is induction, second is consolidation, and then last is maintenance. So, induction chemotherapy targets remission, which means that leukemia cells are no longer found in bone marrow samples. The normal cells reappear and the blood counts normalize, and this is when remission happens. The consolidation phase takes place once the leukemia is in remission, and this occurs over several months. This stage involves combining several chemotherapy drugs to help prevent the leftover leukemia cells from developing resistance. If the leukemia remains in remission after induction and consolidation, maintenance therapy can take place. So, maintenance therapy involves the administration of drugs that are taken by mouth and given through an IV. If the leukemia is not going away, then treatment might need to become more aggressive or sustained. Um, if the leukemia returns shortly after starting treatment, a stem cell transplant may be considered. This is the ideal course of treatment if the child has a sibling who is a good tissue type match. This procedure can also be used for a child that relapses after a second course of chemotherapy. So, what are some music therapy techniques that can be used for children with leukemia? So, the first is going to be music listening for relaxation. So, this could be live or pre recorded music, and it can be used to help calm a child while they are receiving treatment. Second one is song lyric discussion around a favorite song. This could be beneficial for teens and a way to explore feelings surrounding diagnosis, hospitalization, and treatment. Instrument lessons can be used to promote cognitive development, enhance mastery and empowerment, and facilitate self expression. And then lastly, songwriting facilitates opportunities for expression and communication of thoughts and feelings. So there is a case study with a patient named Jack. So Jack was a 17-year-old adolescent that was diagnosed with acute lymphocytic leukemia at the age of 8. So he relapsed for the second time and he was scheduled for a bone marrow transplant. Um, and the music therapy started before his bone marrow transplant. So he was referred to music therapy for psychosocial support. His mom was worried that Jack was refusing to speak about his illness and relapse, and he had become quiet and withdrawn. So, over the course of 6 sessions, Jack began to speak openly about his reactions and feelings toward his illness and relapse. He also wrote a self composed blues song called Crazy Life Blues, which discusses mixed feelings of frustration regarding his relapse and hopes for the future. So, Jack had to be transferred to the adult hospital after his third relapse in order to have the bone marrow transplant. There were a lot of potential complications involved, and these were infections, graft versus host disease, failure of the procedure, and graft failure as well. Um, So there was actually, after Jack had done his bone marrow transplant, he had a poem that was framed next to his bed. And the music therapist suggested that they put some music to the poem. And when this suggestion was made, Jack's face lit up and his demeanor completely changed. Um, and actually, this whole process of music therapy, the staff members reported that Jack openly opened up to the music therapist while being closed off to everyone, including his caregivers. He had a lot of confidence and trust in the music therapy. There was a special connection between him and his music therapist. So concluding thoughts for the case study and music therapy with children that have leukemia. So music therapy provided opportunities for Jack to acknowledge, support, and explore his feelings regarding hospitalization during bone marrow transplant and his own songs and improvisations. Also, diagnosis and treatment of cancer is often described as a roller coaster ride. There are many ups, there are many downs, things can change quite quickly, and this can be very overwhelming for the patient and their family. So, in order to accommodate this roller coaster ride, the music therapist has to be really, really flexible to accommodate the needs of children and their families during this time. And these are my references. I will stop share and